Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are a new or regular viewer that has not had a chance yet to subscribe, please do subscribe. This is the best way you can showcase your support of my content. It helps me tremendously and it helps so many other people to find this channel. So please do subscribe. I'm incredibly grateful if you do. And for all of those of you who already are, thank you so very much. For today's video, let's discuss when is a good time to get breast augmentation. And I'll give you some of my tips and some of my guidance suggestions on how to decide what size of breast augmentation, what size of breast implants to go with. I'm also going to link, let me just put down so that I don't forget, link down below some of the blog posts that I have made on the difference between when it comes to choosing between saline versus silicone implants to help you make that better decision. So breast augmentation, in my experience working with so many trans women, breast augmentation oftentimes ends up being, if the surgical transition is part of a person's goals, surgical breast augmentation ends up being the last surgery. In my experience, oftentimes people have either facial feminization as the very first surgery or genital surgery. The reason for facial feminization is I think, pretty obvious. Face is something that is um, we present to the world. Everybody can see our faces. Our face is something that gives people tremendous amount of dysphoria. If passing is a priority and if surgeries are going to be part of one's transitional goals, people often go for facial feminization for those reasons. Gentles, on the other hand, is something that's invisible to outside observers. Gentles is something that is private and personal. And usually, in my experience, people who do go for gentle surgery first are people who are either don't feel like they want or need facial feminization and really want gentle surgery, or genitals gives them quite a bit of dysphoria where it is so strong and severe that that's the first surgeries I have. Breast augmentation, on the other hand, I would say probably 99% of people I worked with tend to get as a last surgery. Not only because the size of breasts don't necessarily define a woman's identity. Um, there's a lot of women out there with smaller chests to larger breasts. On top of that, a lot of people out there wait to see what are the changes, what is the growth they can get naturally on feminizing hormones. That is one of the primary reasons, waiting to see what changes one can get just from hormones alone. A combination of estrogen therapy. On top of that, a lot of people also start including progesterone, which also helps with breast growth, to see what kind of breast size they can achieve. Some of you already know this. Some of you already have achieved breast size that makes you feel comfortable, makes you feel connected and aligned to yourself. Some people feel that the breast size they achieve doesn't make them feel comfortable. People decide to get breast augmentation surgery for a number of reasons. Most common ones that I've seen is the breast size they have achieved is still giving them dysphoria, doesn't make them feel comfortable. The breast size they achieved may be enough, but the breast shape is more cone-shaped versus a teardrop shape, and so it's a shape overall that makes them uncomfortable. Or what I also see quite a bit is that people feel like bigger breast size that they can only get with implants at that point is going to help 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 feminize the rest of the physique, help make for individuals who feel like their shoulders are too broad, helps them make their shoulders in comparison to the larger breast size look smaller. So it becomes more a physique type of thing. But people decide to get breast augmentation obviously for a lot of other reasons. Um, and whatever your reasons are, that is your prerogative. That is, it's really important to first and foremost to even understand what your personal reasons are. But breast augmentation usually is the last surgery. I myself, as a clinician, as somebody who is the gender specialist, often tell my clients that I would personally recommend, if it doesn't give you a lot of dysphoria, to wait for breast augmentation. Not only because a lot of things might change, how you feel about your breast might change, how you evolve might change. You may realize you don't even need, first you wanted breast augmentation. Down the road, you may realize you don't even need it at all, or you may realize that you do want it. You may also achieve the breast size that makes you really happy. So it's one of the surgeries that, first of all, it's also not very difficult to schedule in terms of getting in the doctor's office. Chances are in the United States, most of insurances don't really cover breast augmentation for individuals. So it's, for a lot of people, it still ends up out-of-pocket expense. So for all of those reasons, it makes sense to, unless it gives you a lot of distress, to leave it until the very last surgery. When it comes to deciding when to have breast augmentation, this is my best tip for you, is see if you can wait it out until last minute, because I have seen a lot of things change in people. I have seen where when I started working with people, they really wanted to have large breasts. A lot of times, sometimes we carry this cultural, societal engraved views that large breasts equals femininity, equals a woman. And if I have large breasts, nobody will ever misgender me because only women have large breasts. I know it's very black and white, but that is still engraved in a lot of people. And so in the beginning, it's very common for me to see people who are desiring to get breast augmentation for those reasons. And as they go through gender transition and as they go through other gender affirming surgeries, if that's part of their transition goals, a lot of times what I see is their perspective changes. And that changes because your relationship to your body will change too. In the beginning, it's it's very natural for a lot of you to have a very idealized view of your own femininity. And a lot of times that idealized view of femininity could be a stereotypical, um, you know, Aphrodite figure, curvy hips and small waist and larger breasts, long hair. I'm thinking of all of the stereotype. I'm imagining that Aphrodite, that classic Aphrodite nude sculpture next to a seashell. It's natural to have that type of idealized view, as if all women look like that, and strive for that. But as a person goes through evolution, through their own gender evolution, a lot of women realize that that is not really in alignment with how they see their femininity. And they realize that what really appeals to them aesthetically are smaller breasts or medium-sized breasts. Or for some people, what appeals to them as aesthetically is still larger breasts. So when it comes to breasts, it's one of the things that I see tends to change so much as the person goes through their own gender process, that I just think it's prudent to leave it as a last type of surgery. So that way you really feel, you have really kind of feel more connected to yourself and to your femininity and your to womanhood and to your body. And you can make a better decision when it comes to that. So that would be my guidance for you, is that if you're thinking about breast augmentation, do see if you can leave it until the last. Because I just think there's a very high chance, from my experience, that a lot of things might change along the way. And those of you who are watching this may already experience this. Some of you may have started off with desiring big breasts, and now as you're going through the process, you're realizing that you're loving your natural breasts. Maybe what you love about your breasts is that they are actually natural. They're your breasts. They're your naturally developed breasts without, however we want to look at it, breast augmentation is still artificial to the extent that you're still getting implants in, whether they're silicone or saline, unless you're getting fat transfer, which I don't really, I don't really know how sustainable fat grafting is long term. I had clients who had it, and then over some time it dissipated. So But if we're just looking at the breast implants, you're still getting something artificial. And for a lot of people, what they love is the naturalness of their body. And that might happen to you too. And for some of you, it already happened. And so, first, you may still want larger breasts, but the feeling of the naturalness of the smaller breast may actually appeal to you as, again, you're going through your own gender process. And it may not, it may change. But again, with breast augmentation, unless there's a very strong sense of dysphoria, I think it's a good idea to kind of give it a little bit of time to see how you may feel down the road. In terms of the size, I have seen a lot of people uh, make this, which I will say, I think it's a mistake. I've seen a lot of women go into surgical office and leave the breast size up to surgeon to decide because they believe that surgeon, by doing so many breast augmentation, knows what will look proportionally best in your body. And that could be true, but it also implies that a surgeon has a very good perception of proportionality, and some surgeons may not. Some surgeons may think that what looks good proportionally are large breasts. I actually know a surgeon like this here in California who advises everybody to get large breasts because, in his view, large breasts is the best proportion for a woman. So it seems like no matter what your body size is, everybody working out of that office has larger breasts. Surgeons just, even if they recommend something that proportionally will be better, you are the one who's going to have to live with that breast size. It's going to affect how you relate and look at your body. It's going to affect if you tend to sleep on your stomach or on your side. It's going to also affect how you sleep. It's going to affect the clothes you can wear and how that clothes aesthetically is going to look at you, on you. And so what I recommend, instead of asking surgeon, and I'm not saying you should disregard surgeon's suggestion. You may ask, and in fact, it would be a good idea to ask them for suggestion and incorporate them into your overall decision versus blindly following their advice. What I recommend is to do an old-fashioned rice test. You take a little sock and you put, 1 cup of rice, 2 cups of rice, 3 cups of rice, or some other grain, and you put it in a bra and you try to spend 24 hours a day, 2 days, maybe a whole week walking around with a particular size. What does it feel like? How do you feel like with a particular size? I've seen so many women I worked with who really thought they wanted a big size, and then they did the rice test and they said, "Oh my God, Dr. Z, I didn't realize it felt so large, it felt uncomfortable. How I felt in my clothes didn't feel right. I didn't feel comfortable sleeping that way." And that in of itself helped them reevaluate the size that might be best for them. I have seen people who had breast implants done and then felt like in the end, it ended up being too large. I've seen people who equally had breast implants done that they regretted not go bigger. So this is the best way. Try it out. Sample it out. Spend some time with it. Um, there was a time when I wanted to get a tattoo. And so what I did is I bought one of those. I wanted to get a tattoo on my arm. And what I did, clearly I didn't chickened out. Um, Actually, the tattoo artist kind of dropped the ball. But what I did is I got one of those printing stickers and I printed out exactly the design I wanted and I wore it. I wore it for the whole week. And what I realized when I wore it is that I loved how it looked on me only when I wear particular clothing. I loved how it looked when I was wearing jeans and casual. But the minute I dress more um, classy for my work, I just felt like it's somehow didn't really go with my aesthetic as well. I wouldn't have known that otherwise if I didn't try it. And the same thing with breast implants. Try it out. Just try the old-fashioned rice test. You can Google it online, rice breast size measurement. It will actually tell you how much a cup of rice will yield in terms of cc's when it comes to the breast implants. So that way, when you go to doctor, you can actually say, yeah, 300 cc or 250 or 350. I already tried it out. Works best for me. A lot of times people wait for last minute to go to the doctor's office. They have never thought about it. And then they tell the doctor, I'm not really sure. What do you think? So they leave it to the doctor to decide. And the doctor oftentimes will bring out one or maybe two types of breast implant sizes. And the doctor will say, well, I think it's either this one or this one. Why don't you go ahead and try it while we're here? And so you try it on right there in the office. It's uncomfortable. You're in front of a doctor. You're not really fully in your comfort zone. You don't have enough time to explore what it really feels like. And so you end up having almost feel of pressurizing, being pressured into making decision. For this reason, I really recommend if you're really thinking about breast augmentation surgery and you're serious about it, for the whole week, just try it out, sample it out, and see what different breast sizes look like. You might surprise yourself. That is my biggest recommendation. So those are my two biggest tips: is give yourself time to wait for it, and also try on sizes, because we think we know what we want up here, but it's not until we actually experience it in our bodies that we can get a sense of how we really embody it overall. And the process of gender affirming surgery is one of not just alignment, but also of embodiment. And so it's really important for you to be able to embody yourself so you know how you feel. So this is my two recommendations. I'm going to try to remember to link that article on saline versus silicone implants. Let me know how you decided. Let me know if you had breast augmentation. Are you happy with the size you went with? What helped you make decision? Comment below, share all of that. Love reading all of your comments. Please do like and comment on this video. It will help the crazy YouTube algorithms, and I will see you all next time. Goodbye.